Welcome everyone to Dr. Nguyen's YouTube channel. Here we unravel the mysteries of health, wellness and disease. Today's focus is Alzheimer's disease, exploring its overview, causes, symptoms, diagnosis, treatment and prevention. Now, let's delve into the world of Alzheimer's disease. Alzheimer's disease, a term that has become too common in our society. But what is it exactly? Alzheimer's disease is a progressive disorder that causes brain cells to waste away and die. It's the most common cause of dementia, a continuous decline in thinking, behavioral and social skills that disrupts a person's ability to function independently. Imagine a city where the power lines start to degrade, the lights flicker, then go out, leaving the city in darkness. That's Alzheimer's. It gradually extinguishes the lights of neural connections in our brain, robbing people of their memories, their personalities, their very selves. The impact of Alzheimer's is immense, affecting millions of people around the world. It doesn't just affect the person with the disease, it impacts their families, friends, and the wider society. Knowledge is power. Understanding Alzheimer's is the first step towards combating it. What causes Alzheimer's disease? It's a question that has puzzled scientists for years. Alzheimer's disease, a complex and multifaceted disorder, is believed to be caused by a combination of genetic, lifestyle, and environmental factors that affect the brain over time. Let's delve into these factors. Firstly, genetics play a significant role. Certain genes, like the APOE4 gene, have been linked to a higher risk of developing the disease. However, having these genes doesn't guarantee that you'll develop Alzheimer's, it just raises your risk. Next, age is a major risk factor. Most people with Alzheimer's are 65 or older, but Alzheimer's is not a normal part of aging. It's just that the likelihood of developing Alzheimer's doubles about every 5 years after age 65. Other risk factors include previous severe head injuries, a history of depression, high blood pressure, and certain lifestyle factors, like a lack of exercise and a poor diet. While the exact cause remains unknown, these factors significantly increase the risk. Detecting Alzheimer's early can make a huge difference. This is not just a saying, it's a fact, one that can be life-changing for many. So, what are the signs that we need to look out for? And how exactly is Alzheimer's diagnosed? Early symptoms of Alzheimer's can be subtle. They can start with slight changes in memory and thinking skills. Perhaps you notice a loved one forgetting simple words or misplacing objects. They could be struggling with tasks that were once second nature, like preparing a meal or using a mobile phone. Changes in mood or personality might also surface. They might seem unusually sad, fearful, or anxious. They may become easily upset at home, at work, or in places where they are out of their comfort zone. But remember, these symptoms can also occur in normal aging or other conditions. That's why it's important to consult a healthcare professional if you notice these changes. A comprehensive medical evaluation is necessary to rule out other potential causes and confirm a diagnosis of Alzheimer's. Diagnosing Alzheimer's is a multi-step process. It typically begins with a thorough medical history and physical examination. Doctors may also conduct cognitive tests to assess memory, problem-solving skills, attention span, counting, and language. In some cases, brain imaging tests like CT scans or MRIs can be used to rule out other conditions. However, the only definitive way to diagnose Alzheimer's is through a post-mortem examination of brain tissue. This might sound bleak, but the good news is that diagnostic tools are improving, and research is advancing to identify the disease earlier and more accurately. It's crucial to remember that while Alzheimer's is a challenging disease, early detection can make a significant difference. It can provide more time to plan for the future, explore treatments, and adopt strategies to manage symptoms. It can also open doors to participate in clinical trials that can contribute to research advancements. So, keep an eye out for the symptoms, and don't hesitate to seek professional help if you notice them in yourself or a loved one. Remember, early detection can lead to better management of the disease. While there is currently no cure for Alzheimer's, there are ways to manage the symptoms. As we navigate the complex world of Alzheimer's treatment and prevention, it's important to remember this key fact. There are several approved drugs that can help with cognitive symptoms like memory loss and confusion, among others. These medications work by regulating neurotransmitters, the brain chemicals that transmit messages between neurons. They can help slow the progression of symptoms for a time, making it easier for individuals with Alzheimer's to carry on with daily activities. However, these treatments are not a cure, and they can't stop the disease from progressing. But they can make life more manageable for those living with Alzheimer's and their caregivers. Now let's shift gears to prevention. While there's no surefire way to prevent Alzheimer's, certain lifestyle choices can help reduce your risk. A heart-healthy diet, regular physical exercise, and keeping your mind active are all part of a healthy lifestyle that can help keep Alzheimer's at bay. The connection between the heart and the brain is key to understanding Alzheimer's prevention. Conditions that damage the heart or blood vessels, including high blood pressure, heart disease, stroke, diabetes, and high cholesterol, can all contribute to Alzheimer's disease. So, maintaining a healthy heart can also mean maintaining a healthy brain. Regular physical exercise is crucial, as it helps maintain good blood flow to the brain and encourages new brain cells. A heart-healthy diet rich in fruits, vegetables, lean protein, and low-fat dairy can also help prevent Alzheimer's. Keeping your mind active and engaged can also help. Challenge yourself with mental exercises like reading, writing, or playing strategy games to stimulate your brain and keep it sharp. In addition, staying socially active can also help stave off Alzheimer's. Engage in community activities, spend time with friends and family, volunteer, or join a club or group. While we can't prevent Alzheimer's completely, we can delay its onset and slow its progress. By adopting a healthy lifestyle, you're not just fighting against Alzheimer's, but also improving your overall health and well-being. Living with Alzheimer's or caring for someone who has it can be challenging. It's a journey filled with hurdles and questions that can seem overwhelming. But remember, you're not alone. One of the most common problems faced by those living with Alzheimer's is memory loss. It's not just about forgetting where the keys are, but more profound, like forgetting loved ones or important life events. This can be incredibly distressing both for the individual and their family. The key here is patience and understanding. Encourage reminiscing and use memory aids like photographs and familiar items to help spark memories. Another prevalent issue is confusion about time and place. Patients often lose track of dates, seasons, and the passage of time. They may even forget where they are or how they got there. In these instances, maintaining a routine and keeping a visible calendar can help. Now let's address a frequently asked question: is Alzheimer's hereditary? The answer is, it can be. While the most common form of Alzheimer's isn't directly inherited, a family history of the disease can increase your risk. Another question we often hear is, can Alzheimer's be prevented? Unfortunately, there's no surefire way to prevent Alzheimer's. However, maintaining a healthy lifestyle, including regular exercise, a balanced diet, and keeping your mind active, can help lower the risk. Being informed and prepared can make the journey a little easier. Remember, it's okay to ask questions, seek help, and take care of yourself too. It's not an easy road, but understanding and support can make a world of difference. Alzheimer's disease is a formidable foe, but we are not powerless against it. We've journeyed through the landscape of this complex illness together, unraveling its intricacies from understanding what it is, to exploring its causes, recognizing its symptoms, and learning about its diagnosis. We've delved into the treatments available, and most importantly, we've discovered how prevention can play a pivotal role in combating this disease. We've addressed common problems and questions, demystifying this condition that affects so many lives around the world. It's crucial to remember that knowledge is our greatest weapon. Being aware of the early signs, understanding the importance of a timely diagnosis, and knowing the treatment options available are all key steps in this battle. Prevention is not just about avoiding the disease, but also about enhancing the quality of life. Let's not forget, Alzheimer's isn't just a disease that affects individuals. It affects families, communities, entire societies. So let's fight it together. Share this information, spread awareness, and make a difference. Stay informed, stay vigilant, and remember, you're not alone in this fight.